Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Breastfeeding stands as a cornerstone of maternal and infant health, offering unparalleled nutritional benefits and fostering a unique bond. Beyond its physiological advantages, it promotes emotional security and long-term well-being for mothers and babies. This natural process helps mothers recover from childbirth, reduces stress and anxiety, and lowers the risk of certain cancers. Understanding the multifaceted benefits of breastfeeding is crucial for promoting the overall health and mental well-being of both mother and baby. As we advocate for breastfeeding, let us empower mothers with the knowledge and support they need to embark on this transformative journey. Together, we can ensure healthier futures and stronger connections in every breastfeeding experience. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today, to help us understand the significance of breastfeeding for both mothers and their babies, we have with us renowned health experts Dr. Meghana Sultania and Dr. Manisha Gaur. Dr. Meghana is a highly accomplished pediatrician and neonatologist, bringing over 12 years of dedicated experience in child health and development. She currently practices at the Capsule Child and Neuro Multispeciality Center in Faridabad, where she is renowned for her expertise and compassionate care. Dr. Meghana specializes in a wide range of pediatric services, including managing pediatric patients, immunizations, and treating pediatric infections. She is adept at handling routine infections, growth, and development in children, along with addressing nutrition issues for both pediatric and adolescent patients. Her commitment to her field is reflected in her comprehensive approach to healthcare, where it ensures the well-being and development of her young patients. Our second expert today is Dr. Manisha Gaur. Dr. Manisha Gaur is a distinguished, licensed clinical psychologist and counselor at the esteemed Gaur Mental Health Clinic, De-Addiction and Heart-to-Heart Counseling Center in Civil Lines, Ajmer. She is trained in child and adolescent psychology from National Institute of Mental Health and Neurosciences, Bangalore. With a profound commitment to her field, Dr. Gaur delivers compassionate care and utilizes evidence-based therapies to address a wide range of psychological concerns. Her exceptional work is particularly focused on improving the psychological management of the mother-baby bond by fostering healthier and more supportive relationships between mothers and their infants. Dr. Gaur aims to lay the groundwork for a brighter and more emotionally resilient future for families. Her dedication to enhancing mental health and well-being underscores her pivotal role in the field of clinical psychology. Dr. Manisha, Dr. Meghana, a very warm welcome to this special edition of Health Files, ma'am.
Thank you.
Thank you. Thank you so much for joining us, ma'am. Okay, so Dr. Meghana, I'm going to start with you, ma'am. A lot has been said, about the benefits of mother's milk and more importantly, mother's first milk for a child. But what is the situation like in the real world? I mean, do you find more mothers taking up breastfeeding because of the various awareness campaigns?
Yes, very valid question. Motivation is the key when it comes to breastfeeding. So awareness campaign always helps. And if we talk about the real world situation, there is a little data which recent NFHS, and that suggests that from the last NFHS of 55%, the exclusive breastfeeding rate has increased to 55%.
One common problem that a lot of mothers face, in feeding the first milk, especially when it is a cesarean delivery, or the baby, is being put in the neonatal ICU. The mother does not get the baby on her lap even for a day. So how difficult does it become to start breastfeeding after that?
See, LSTS is a situation. I mean, cesarean delivery is a situation where there is some issue because of which a natural birth process cannot happen or may put somebody at risk, either the mother or child. So the cesarean is being performed. In such a situation, by our guidelines, we say the breastfeeding has to be started within 1 hour of birth, which
Right.
as contrast to say within 30 minutes of normal delivery. Okay.
Okay.
Now, here the challenges are few, like first, the mother will be in the post-operative setup for observation. She won't
Right.
directly go to her home for her own health, right? So the
Right.
rooming in gets affected. Even if mother's health is okay, baby's term, baby's health is okay, the rooming in concept gets affected because she's in the post-operative room. So in such cases, we can generally advise babies to be with mother itself with an attendant, where certain other positions like supine positions, etc., are advised with the help of attendant, where the suckling can be started at least within 1 hour of birth. And of course, they can always express breast milk and care. Now, when the situation complicates, when the baby is in trouble, for example, say prematurity or breathing difficulty and goes to NIC, then in that case, still the colostrum can be extracted and kept in freezer. All the NICUs, they have fridge, so with the freezer facility, and then that can be restarted whenever the baby is fit to take the milk, either through tube or through oral feeds, whichever is applicable in that situation. Bigger challenge is when the mother has an issue, say example eclampsia, and she goes to ICU or something. In that case, then it is very, very challenging. Sometimes extraction is also challenging.
Okay.
But I would also support in this situation that the recent data suggest that initiation of breastfeeding percentage was same in normal delivery and cesarean. So this is a matter of concern where a normal vaginal delivery, it has to start because there is no other obstacle for such deliveries. So I think that can be.
Right. And now from the first milk of the child to the mother's mental health. Dr. Manisha, how does breastfeeding affect mother's postpartum mental well-being?
So breastfeeding is very important for the mental well-being. Initial touch of the mother and the child is important. So the child has been in the mother's womb for all 9 months with has been getting all the things, all the requirements of the child have been being fulfilled in the mother's womb without any, the child has not been crying, child did not demand for anything, and it has been fulfilled directly. So as the child comes out, then for all the requirement, child has to ask. If the child is crying, then the child is being fed. If the child, child doesn't get everything without asking. So that if those things are not done, and if the touch of the child and the mother is not there, it affects the baby's mental health. So the first thing which generally I ask my students also interns when they come for the training, I ask them that what do you feel the child first gets connected, or when does the child identifies the mother first? So they come and tell me that, ma'am, maybe 6 months or 3 months, or when the child starts seeing the mother. No, it is when the mother starts lactating the child, that is after the 1 hour. An hour too. So it is the breastfeeding through which the child identifies the mother. So breastfeeding is that important that the physical connect develops.
Right.
So that develops the care and the connect of the mother and the child. The smell, the skin touch.
Right. And when it comes to mother's mental health, ma'am, we do not talk about it much. We do not create much awareness about it. And when we talk about the benefits of breastfeeding in particular, so do you think we are missing conveying the mental health benefits of breastfeeding to new mothers?
Yes, they are, because mental health is very important. They do not know that what are the benefits of the mental health. So breastfeeding is just that, okay, because the child needs all the nutrition, that is why the breastfeeding is important. But the breastfeeding is also important because it is going to develop a lot of bonding and care in the mother. Other than that, the stress levels are going to be, the stress levels which happens due to the hormones which are changing during the
Right.
time. It gets a lot of calmness
Right.
when the mother lactates the child. The mother feels relaxed because of the hormones that is released, the prolactin
Right.
and the oxytocins, and mother gets better sleep.
Right.
Mother also gets, the feeling of relief and the calmness. So there are
Right.
many things which helps her to get out of that fear, out of that pain, inflammations, and all those things, which helps her from getting that postpartum, out of that postpartum depression. That
Right.
probability that she might get into that postpartum depression also decreases. It also
Right.
helps her out in decreasing the probability of getting into heart problems or diabetes, these kinds. So lactation helps in the mother's mental health also.
Right. And now I'm going to come about the working mothers. I'm going to come back to you, Meghna ma'am. A lot of working mothers, they have to join back offices, soon after delivery. Uh, as a result, breastfeeding, usually takes a back seat. So what are the common ways a working mother can tackle, this problem with?
Yes. See, work, life, and baby balance is a big, big challenge. So,
Right, ma'am.
first thing needed is a support. This year's theme, 2024 theme of Breastfeeding Week is also about family supporting the breastfeeding mother. So when the
Right,
family mentality is like that it is not just her responsibility, automatically they can chip in for small, small work, which can
right,
help mother set a routine, right?
right, ma'am.
So routine has to be that first she has to feed baby directly before she leaves. Then she
Okay,
has to learn extracting breast milk, right? And
right,
by the pump. It can be done by electric pump, manual pump, or even by the hand extraction. All three
right,
possibilities are there.
right,
Then
ma'am.
they should be well aware about how milk can be stored, how milk can be thawed, and once thawed, it should not be stored again. And
Right,
the deep freezer also, you can store milk for a very longer time. Then
right,
simple tips for cleanliness and hygiene should be known. And
right,
once these things are done, when she comes back, she has to directly breastfeed baby. That's very important because you don't lose that touch, skin to skin
right,
touch, right?
right,
So few
right,
hours you're not there. When you come back, generally the mother and baby both are wanting to be with each other. That's the
right,
situation,
right.
right?
Okay,
And last important is she has to eat well because while doing this balances, what she forgets to do is eating well, right?
right,
And that need can only be completed with the support of family and husband, right? And
right,
last but not least, you should not shy away from taking support. कि सब कुछ
right,
मैंने ही करना है ऐसे नहीं करना है you must have support start whichever is possible by whatever methods but you should do that and
right,
very importantly the government's role will come in this because breastfeeding exclusively for 6 months is not just mother's or family responsibility those
right,
babies will be patients youth so
right,
government has to make a policy that even in private institutions they should give 6 months maternity leave.
right.
Then only the targets will be achieved.
So support is the key for a working mother. Right.
Yes.
So on that note, Manisha ma'am, I'm going to come back to you. Does the situation of not being able to feed her child, particularly in case of a working mother, have an impact on the mother's mental health?
It does. It does. It is something very nice. So see, it depends. It varies into different situations. Here, when we talk about the urban areas and we talk about the rural areas. So in rural areas, it is supposed to be like, okay, mandatory.
Yeah.
माँ का दूध तो पिलाना ही है, तो
जी.
जाके दूध पिला के लाओ. People are more aware of it. But in urban areas, working mothers are like more into that we have to like just now as talked about by Dr. Meghana also that it should be made, government should make it mandatory that 6
Yes.
months it should be there that mother should lactate, breastfeeding
Right.
should be there.
Right.
So it's not that much, people are not that much aware of, they are more into the work. So the pumping and all those things should be there. So
Right.
people are not much aware about all these things.
Ji.
So when they are not able to pump out, when they are not able to breastfeed, there is a feeling of unrest, which again hampers the mental health.
Right.
Because they're at unrest, because they're not able to feed the baby, the
Right.
back of the mind, because they're not getting that break from the work, back of the
Right.
mind, they're always thinking about the baby, what my baby must be doing. Is my baby fine? Every time the baby cries, there is a feeling in the mother. If the mother is
Right.
breastfeeding, there's a
Right.
feeling in mother's mind
Right.
that my baby is not happy, that my baby is not fine. So in the urban areas, the feeling is little dicey with the mothers who want to feed and with the mothers who are getting into the rat race of getting into work more and more.
Okay.
So here I think
And
you will, yeah.
yeah. But I still wanted to know about this. I mean, I have one more thing that is really coming to my mind is that you're saying that the mother gets to know whether her baby is not happy, right? So clearly, it is mentally affecting her. And if it hurts a mother's, mental health, then are all mothers able to understand this? Or is it just a guilt feeling that manifests in the subconscious mind that, it doesn't show in apparent symptoms?
So all the mothers are not aware of it, but
Okay.
how do they work on, how do they react? So mothers get
Yes.
irritable. Mothers do not reflect on it directly. They get
Right.
irritable. They
Right.
shout and are not able to concentrate.
Right.
So the symptoms, we won't call it as a postpartum depression, but
Okay.
again, the symptoms of anxiety becomes. So again, the restlessness, the feeling of restlessness is there, feeling of
Right.
palpitation is there. They
Right.
don't feel like being at one place constantly.
Right.
Unrest is there. And then gradually they have this feel of as if they get that panic,
Right. Okay.
not
Right.
happy. Dull feeling is there, feeling of low feeling is there, and they do not feel like doing what they are doing. They're
Right.
not able to concentrate on the work.
Right.
They lose interest in all the work. They lose interest in the office work. They lose interest.
Yes.
Gradually, they lose interest in getting ready. They lose interest. They have this negative feeling, and gradually, the sadness, and that sadness increases. If that sadness is persistent for 2 months, if that sadness is persistent for like more than 2 weeks, 3 weeks, and it's continuous for a month or two, then it gets into depression.
And अब आते हैं हम उन मदर्स पे जो शायद डिप्रेशन के साथ साथ एक और प्रॉब्लम से भी जूझ सकते हैं मेघना मैम, दैट इज व्हेन दे आर नॉट एबल टू प्रोड्यूस इनफ मिल्क. And even if they do, the worry about, not being able to feed their child enough is always, in their mind. So when it comes to feeding the baby, how much is enough?
Right. I would like to start with what we just ended up with the question. The
Right,
guilt
ma'am.
is a very important feeling here,
Right,
and they so easily, and everybody around them also make them feel it so easily.
right,
Whatever
ma'am.
happens, that comes in mind. Or the husband says maybe you should give more time, but how? That
Yes.
question never happens. So I generally see that working, non-working, in both the cases, confusion is the point from where they start feeling that they are not enough. And this can
Right.
progress to even that they are not good enough. And that is
Okay.
scary. That's not needed absolutely. So
Right.
first we need to understand that from the newborn stage, that just born baby to 28, 29 days, normally you should ideally breastfeed from one breast completely. And I
Right.
say it should be at least 20 to 25 minutes. I generally
Right.
advise when you sit, look at the clock, because when you sit for a longer time, just with the baby, you feel, oh, 10 minutes, what time? So
Ji.
it doesn't work that way. You look at the clock,
Right.
it's 12,
Mhm.
by 12:25, you have to make sure that baby latches from one side, right?
Right.
And
Right.
that completely empties the breast watery milk plus the hind milk, which is a lot of fat movements. After the hind milk is over, then only the baby will have satiety, and that's the key. Okay.
Right.
After that, it will work really well, and then offer the breast for say 5 to 10 minutes. Little watery milk baby will take. And if
Ji.
you have completed this chore, then the baby will take 2.5 to 3 hours of sleep for sure. As the baby grows, like 3 months or 4 months, then they have a good weight and they are able to do this work little more faster, like say 15 to 20 minutes, but never 10 minutes. 10 minutes is insufficient time. So I
Ji.
would always want to say it is probably the insufficient time, not insufficient view. Okay?
Right.
And plus,
Right.
the way baby will latch, the longer the baby will latch, then only the breast milk will come. This is a reflex where your brain has to understand that somebody is feeding on you. If you fill
Right.
it up with a bottle feeding, there is no skin touch, then the brain does not understand. The
Right.
hormonal level automatically goes down. Right?
Right.
The last thing I would like to add is a night feed. You should not avoid night feeds completely because nighttime
Okay.
oxytocin speaks very nicely.
Right.
And that time feed is on a like in a little more quantity. And
Right.
thirdly, you can go for natural galactogogues if you have such things in mind, right? Like
Right.
shatavari, etc.
Right.
And if you have those feelings, like after the baby is being done with the feed, baby takes good sleep for 2.5 hours, chest heaviness is decreased, you feel very thirsty,
Right.
and the other side of the breast automatically drifts. That means you
Okay.
have enough milk, not
Okay.
well.
Right. So feeding the right way is important and not thinking that I am not good enough. Right, ma'am. So, Manisha, ma'am, on that note, for mothers who are not producing enough milk, what are the mental challenges you see in them? I mean, how can and the family support them better?
So, mothers who are not producing enough milk, basically, there's another hormone, the thing which happens is DMER, we call it
Right.
as dysmorphic milk ejection reflex. So, this
Right.
is related to, body's reaction
Right.
that hormone is released if the mother is
Right.
not able to breastfeed properly.
Right.
So this is all about unhappiness. There is unhappiness in the mother because mother is expected कि माँ है तो दूध तो पिलाएगी, माँ है तो
जी.
दूध तो पूरा आएगा ही आएगा. So
जी.
it again it depends on the emotion. If the mother is happy, will be able to produce
Right.
enough milk. If mother is not happy, if mother is low, if mother is suffering from depression, of course she will not be able to produce that milk
Right.
in that happiness, and she'll develop more of frustration.
Right.
So in that case, family, she will have more of that family pressure. And because of that family pressure, the stress levels will increase more. In
Right.
that case, she needs to have that, family has to understand her more. She needs to have more of supportive environment
Right.
rather than she being told कि तेरे तो दूध ही नहीं आता है.
जी.
She's not able to feed the child.
जी.
She doesn't have that capacity. She has to
जी.
bottle feed. No, it is not that if you're not able to feed your child, you cannot make a good connection with your child.
Right.
Breastfeed is not only the way to make a connect with the child. If you
Right.
have to make a breastfeed is a very good way to connect with the child. It is very important to provide all the nutrition what a mother's milk can provide nutrition to the child, mental
Right.
health for mental health and as well as for the physical health.
Right.
Nothing can substitute that. But yes,
Right.
for that emotional connect, it is very important that the family has to support the mother. And it is very important that the mother has to support the child as well. The mother
Right.
has to stay connected, keep herself happy, and has to communicate with the child while she is feeding the child anyhow. Even if she is
Okay.
feeding the child through the bottle, she has to keep an eye contact with the child rather
Right.
than being lost in the
Right.
thoughts, rather than,
Right.
watching reels, watching the
Right.
phone while
Right.
feeding the child.
Right.
She has to stay in touch with the child, talk to the child, play with the hands of the child, um, speak to the child, hear the voice, make the child hear her voice so that she can connect emotionally, mentally better with the child. So that is very important. And the family has to be very supportive with it, for that. It is very important and especially the husband support is most important. Whereas
Absolutely.
the husbands are not very supportive in the families.
Right. Yes, I agree. So on that beautiful note, that family support is very important. Meghna ma'am, is there any situation when you will advise a mother against breastfeeding the baby?
Yes, very few, but they're definitely there. From the baby's point of view, certain babies are born with metabolic defects, we call it galactosemia or phenylketonuria. There we don't give lactose, so breastfeeding is contraindicated in that situation. And in certain cases of mother, when the mother suffers from few viruses like HTLV1 or Ebola, breastfeeding is contraindicated.
Right.
And again, if she's taking anti-cancer medicines or she's on certain antipsychotic drugs also, then it is contraindicated. If there is a local infection with herpes simplex, then also we say local and breast के ऊपर infection है herpes का, तो भी हम उसमें फिर extraction की advice देते हैं generally. And if there is undiagnosed brucellosis or say active tuberculosis, pulmonary tuberculosis, then till the time treatment happens for some time period, maybe it can be advised not to take, depending upon the situation.
Great. And I'm going to come to you with the same question, ma'am. From a mental health perspective, when should breastfeeding be reconsidered?
So basically, whenever the mother is feeling better, and if she feels that she's happy, if she's prepared and she's ready, that yes, I am okay and I'm fine and I want to go on with it, she's mentally prepared that yes, I can feed my child, then she can start on with it. It is all her personal choice. If she's mentally prepared and she can go on with that, then she must go for the breastfeeding again. And if she's not mentally prepared for it, and if it is forced on it, then she would not be able to do justice with the child.
Right.
Because breastfeeding is, it is just not that, it is, all on the hormones. If the mother is happy, then she would be able to produce milk. And if she's not happy, she wouldn't be able to produce that good milk. And mother's milk breastfeeding does not affect the mental health of the mother, but it affects the mental health of the child also, It develops good reasoning abilities in the child. It develops better memory power of the child. It would boost in the language development of the child, and it enhances with the motor skills of the child if the child is better breastfed. So mother thinking all these things, and if she's mentally prepared to go on with the breastfeeding, then she must start on with that.
So on summarizing the session, ma'am, I have a common question for both of you. How can we raise awareness about the benefits of breastfeeding among new parents and communities? Meghana, ma'am, we start with you.
Okay. I think at the last trimester, the mother should be made aware and should be even told a few techniques to prepare her breasts, to locate them if the nipples are right or wrong, because sometimes they're inverted, etc. That problem is seen later on, nothing is being done, and then it creates sort of chaos in 48 to 72 hours. So I think the seventh month onwards, we can try motivating them with advocacy and all. And mothers who have breastfed their babies exclusively from either strata, I mean from village and from cities, I think with the help of social media, if their testimonies would be so lovely to motivate others, that a simple woman from a simple house to a working woman from a city, everybody can and everybody would and should do breastfeeding exclusively.
Yeah, I would want to add on to this that, I mean, Dr. Meghana has very well said about the use of the social media platform. So along with that, we can always use some short films which can be displayed in the rural areas, and we can always start using these short films and the things from the college level, from the time when we teach the young girls about the menstrual cycle, like we teach the young girls about the menstrual cycle from the school time. Similarly, we should start the youth, the young girls, about the breastfeeding from the time they are in the college, they are studying in the college.
Okay.
If we make the awareness during the college time, they won't shy of talking about it once they are in that phase of lactation in the breastfeeding time. Anyways, everybody's doing the best they can.
Yes, I completely
like
agree.
You are doing
Yes,
Thank you so
a
much.
very nice point about college girls being educated so that they're also well empowered about what they are supposed to do when they grow up. Really, it's good. It makes a lot of sense.
Yes.
I would also want to add on this that we generally stress in our OPDs that it protects from cancer, breast cancer. So this is so helpful for the mother. And the babies are also, breastfed babies are generally, we say, lean and clean. And top-fed babies generally tend to be obese when they're adolescent times. So these 2 points, I think we should stress, because these 2 epidemics, slow epidemics we are facing. And I think after 10 years, the next decade, they'll be very, very visible. So I think that is very beneficial in that way.
So in context of awareness, what I read from both the beautiful ladies is that the earlier the better. And well, the message is simple and clear that breastfeeding is significant for both the mothers and their children. Okay. So thank you so much, Manisha ma'am, Meghana ma'am, for joining us on this journey of celebrating motherhood and lending a supporting hand to all the new mothers out there. Thank you so much for joining us today.
Thank you.
Thank you.
Thank you so much, ma'am. Thank you, ma'am. It's really been a pleasure. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, ma'am.